Today's video is all about injections and how to do it correctly. Little disclaimer at the beginning, this is not medical advice. This is what the doctor taught me, and now I'm gonna try my best to teach you. If you feel uncertain or unsure, make sure to go to your doctor and make sure that they teach you correctly. I've been giving myself injections for 2 months and I've been doing good. And I know a good amount of you were curious about how I do it, so I'm going to teach you. By the way, this is the second recording of me trying to explain it because I goofed up and it didn't record correctly. If I had a dime for every time that's happened, I would be able to retire from YouTube. But before we get started, we're going to turn this into 3D with me, IRL me, as I walk through all of this with you. First, we're going to wash our hands with soap and water. Make sure that they're all nice and clean. Whenever you start injections, you should have these things. You should have a 1mm syringe, 2 different needles, a bigger one and a smaller one, your estrogen, alcohol wipe, a band-aid, and a shots container or something to put your needles afterwards. Alright, first thing we're gonna do is wipe down, use the alcohol wipe and wipe down your estrogen lid to make sure it's all nice and clean. After that, take out the needle and put it on the syringe. We want the bigger needle first, because that's the needle we're going to use to pull up the medicine. The smaller one is for the injection for later. To tell which is bigger, just put them side by side. It should be a little easy that way. But for me, what I do is pink. The pink one is bigger, the blue one is smaller. Then we put it on the syringe. Be careful because you may accidentally jab yourself if you use force. Not to name any people, myself. Anyways, make sure that it's all nice and secure as you put it on. Then you can remove the lid. Then, before we even put the needle inside of the vial, we have to pull up the amount of air equal to our dosage. For me, it's 0.2 milligrams of estrogen, so I pull it up to there. After that's done, we insert the needle inside the estrogen, push the air out, and then we start drawing up the medicine. The first time, you're gonna have to pull it to 2, then push out, making sure that your needle is in the medicine and not sucking up air as well. By doing this, we also turn it upside down to pull out the medicine. Make sure to do it slowly and make sure that there's no air pockets or air bubbles in our injection. And if it takes you a few times, that's okay. Just remember to do it slowly, make sure that the needle is in the medicine, and take your time. After we get our dosage, we pull out the needle. Then we pull it back until we have a little air bubble. The reason why we do this is to get the remaining of the medicine that's stuck in the needle. Afterwards, we put the lid back on the big needle and put it in our shots box. Next, we take the blue needle we put in on the syringe, and then we start to push the air out and to get a correct dosage. Don't beat yourself up if you can't get it perfectly. I doubt I get it perfect every time. But usually what I do is I push until a few drops of estrogen leaks out. That's when I know that the medicine is ready. Now for the fun part, I guess, and that is figuring out where to take it. What most people do is take it in like fat areas. Like, for example, some people may do injections by butt, by stomach, but for me, what I do is thighs. And what I do is once a week I switch thighs. So that way I get the best results. How I find out where to poke myself. Using my fingers, I measure my kneecap and my hip bone, and then slowly move my fingers up to the middle point where they meet. Then I do it again on the outside of my thigh, and do that to the middle, and that's where we're injecting. So take your alcohol wipe yourself down, take the needle, take a deep breath in, and then put it in. It may pinch a little. Just relax. I know shots suck. For me, what I do is I sing something as I do it to help me get my mind off it. Before you can inject yourself, we gotta make sure we didn't hit anything. Pull the little butt thing, the injector thing, back a little bit. If you draw up blood with your medicine, then stop what you're doing, throw away the syringe, and make sure that you're taken care of. But that rarely happens. If you pull and there's no resistance, you're good to go. Inject yourself. Afterwards, we take the Band-Aid and cover ourselves up. And we're done. Throw away the syringe, put the needle in the shots box, and hopefully you didn't pass out on me. I know for me afterwards, I feel a little lightheaded, but I'm fine most of the time. Yay! Ouch, we did it. And that's the video. I hope you learned how I gave myself shots, and you can use this for reference whenever you start your transition. Again, everybody does it differently, but this is what I was taught to do by my doctor, and it's been working with me, and that's how I'm gonna keep taking my chops to the future. Thank you all so much for watching this video, and I'll see you in the next one. Pinky out.